Good morning.
Good morning.
I've been here since yesterday, and all the presentations have really inspired me. And when I was preparing this presentation, I tried to focus more on the recovery instead of treatment, because I was a clinician and I was a program director before. That somehow, I feel that I'm kind of a step behind. And bear with me. I'm trying to focus on the recovery services. I just want to share with you that the Asian Americans are not a homogeneous group. We have over 40 different ethnic groups, and the population is fast growing. We have more than 14 million, with the data from the 2006 census. The Asian American concentrate in about 10 to 15 states, but the three metropolitan areas, Los Angeles, San Francisco, and New York, has the largest Asian populations. 9% of U.S. Asian Americans live in New York State, and the majority of that 9% lives in the metropolitan New York. With a high proportion of recent immigrants, more than 35% of Asians speak another Asian language at home. And we are not a homogeneous group with different languages. I can tell you that I'm a Chinese American, and we have 5 or 6 major dialects in China, and I speak the 3 major ones: Mandarin, Cantonese, and Shanghai dialect. But the newest immigrant group, people from Fuzhou, when they speak, it's just like French to me. I don't understand. But luckily, we have the same written language. When we write, then we can understand each other. Also, the Japan and also Korea, they also use some of the Chinese character in their language. We all have different background, different immigration history, with Japanese and Chinese Americans being living in this country for the longest. And the family structure, interpersonal relationship, and cultural values, we share some similar ones, but we also are very different. So working with this group is really a challenge. Hamilton Medicine House is a settlement house, and about 30 years ago we started our first mental health programs, and about 20 years ago we started the first alcoholism clinic. And then when the New York State merged the alcohol and substance abuse program together, we changed into serving both people with alcohol and drug problems. And the program was also from serving the Chinese, that's the majority of the population, even in the country or in New York. We expand the service to cover the areas, communities that's not having any services, such as the Korean communities and Japanese communities. Just want to talk, even though I mentioned about treatment, but that's also part of the recovery supported system, that in general, there's, in the field, there's an underestimation of the extent of the problem, because there's a model minority theory about the Asian, and also there's the Asian population underutilized mental health or substance abuse treatment services. And another thing is we don't have enough dependable statistics and research, but it's in the beginning. Want to mention that NAPFASA, that I'm a board member, is the National Asian American Families Against Substance Abuse headquarters in LA. We're going to have our conference in June, the 5th and the 6th of June, and the NIDA, NIDA has an Asian advisory committee going to be meeting there too. So we really think we need the numbers and the statistics and the research to tell us what's really the needs and how we can best serve our population. In general, people delaying or not seeking the treatment due to shame and stigma and lack of knowledge. People don't have health insurance and other resources. And another thing is this lack of cultural and language appropriate programs, whether there's a treatment program or recovery supported community services. And also there's a lack of evidence-based practice. The services provided to the Asian American, the many mainstream providers often do not have the bilingual staff. I mentioned before because there's no very limited language and culturally appropriate providers, and it's not in all levels of care. In New York City, we have 2 programs, the Hamilton Medicine House and also the Child Center of New York. That provide services. Both programs are outpatient programs. And a lot of service being provided and not being reimbursed. And also, we need a lot of lacking the language appropriate educational material. It's improving. The CSAT knowledge-based application program has doing a lot of translation, not only the Asian language, other languages as well. And the community has all kinds of services, but it's not linked to the treatment or recovery services. Just want to show you what I was talking about, that the underutilization. This is the 3-year the 2005, 6, and 7, because in the whole state, there's only very limited people seeking the treatment, even though the Asian population is almost close to 10% in the state. The crisis services detox because they don't need the language. It's mostly monitoring the physical, withdrawal, so that is pretty high. And then the next thing is the outpatient, because we have 2 programs. So this will show you, that really affects the people in our community for recovery. Maybe I will share with you a little bit about the attitudes toward alcohol and substance use or abuse. Drinking with herbal medicine and cooking is very common, and moderate use of alcohol at social and ceremonial occasions are common. Out with drunken or acting out behavior not tolerated. That also, people told me, why didn't we see any Asians on the barroom? Why didn't we see people fighting? So a lot of our clients, after drinking or using, they go home and sleep. So you don't see them on barroom. So the pattern is, I mentioned before, lack of research, and also in general, our total population, more people are not drinking at all because of the syndrome, lacking the enzyme. And also in general, year after year, from the stem cell research that Asians are found to have used less of the drugs. And they are increasing emissions of treatment. One example is from 94 to 99, that's 37%, from the stem cell report. Also, the different ethnic group within the Asian group, they have different pattern of use. The co-occurring problems is like mental health and gambling. It's very, serious. Especially, I want to make say something about gambling, because when we have the recovery month, I think it's the 2006, September. We have a group of people from the community and the reporters. Everyone, they avoid talking about alcohol and drugs. Everyone says the problem in our community is gambling. So our agency is starting to a program of gambling. We try to look into how we can help people with yeah, I'm short of time, so I come to my conclusion that actually, all the things I heard about the recovery community and my visit last night, actually we do a lot of those things. But those things are not our official business. It's not considered the level of care, how many visits we provide. I'll give you some examples that we do regular outreach. We're glad Oasis applied for the SEMSA grant. That we two programs, both program, Asian program, we do regular outreach. We also do other things such as Tai Chi class for the client, and teach them English so our client can get more get around and getting better jobs, or communicate better with their kids. So I really like this idea of the recovery supported system of care, because we do a lot of that. But how we're going to integrate that in our treatment system? This is a challenge, and because we are mandated to provide certain treatment services for the funding we get. So I think that using the recovery or other kind of a support and follow-up, that's going to help us to get more clients that need help into treatment or into recovery. Thank you.